And we're recording. Good morning. Thank you all so much for joining us on this Saturday morning for, I'm sure, what's going to be a great presentation about social skills and pragmatic language in children. I'm Neil Lichter. I'm one of the program directors here at Pathfinders for Autism. This workshop is brought to you today. We're doing some great collaboration, as always, with our team down on the Upper Eastern Shore with Jennifer Dogie from Queen Anne's County and Stacey Behrens from Talbot County. And they all have a good relationship with Dr. Isava, and he's presented for us a number of times when we used to come down and present live at Chesapeake College and in other places. And hopefully we'll be back to doing that again soon, but we're really happy to be able to come out on a Saturday morning and have a good workshop like this. Dr. Isava is the Executive Director of Halcyon Wellness, licensed psychologist. He oversees the administrative operations of the center, provides comprehensive assessment and psychotherapy services to children and families in individual and in group sessions. Specialty areas include behavioral disorders in children and adolescents, emotional, family therapy, early intervention assessment, all kinds of great stuff for the community right now in Arundel County and a number of down there. He's a great speaker. You're going to get a lot of great information today. If you have questions, put them in the chat box. We're going to put some resources up in the chat box as we go. We've got some great events coming up that I'll talk to you about at some point today. So Dr. Isava, it's all you, and enjoy.
Great. Good morning, everyone. Happy Saturday. Thank you, Neil, for that wonderful introduction. I'm really excited to offer this webinar. This is a much needed and much sought out program, social skills, especially in the pandemic situation now where kids have less opportunities to socialize, and it seems to be a chief complaint and concern by both educators and parents. But we're hoping to offer a series of workshops in the upcoming months that will help close some of the gaps and address some of the concerns that families will have beyond social skills. Today is about social skills, so I'll just jump right into it. The premise of this workshop is not to offer an all-inclusive presentation on social skills. It's primarily to make parents good consumers of mental health, to make parents good advocates for their children when they are seeking mental health for anything around social skills. So my hope is to move you beyond just a diagnosis or a developmental delay and focus on some of the tools that will be helpful, not only for you and in using at home, but when you talk to your providers and educators. And with that said, I have, I'm trying to move to the next slide, Neil. Okay, here we go. This will be our outline. I assume everybody did have an opportunity to obtain the PowerPoint. If not, I'm sure Neil can facilitate that at some time. The four big ideas of socialization is social awareness, which is the ability to be aware of when to use your social skills. Social cognition, which is what are the rules and memories associated with socializing with someone. Social communication is the use of language to actually communicate your interaction with others. And then there's social motivation, which is actually the need to want to do, to socially engage with someone. Keep in mind that every kid is different, whether you have a diagnosis of autism, ADHD, a mood disorder, or just a neurotypical kid developing. All kids to varying degrees have some sort of shortage or gap in their ability to socialize. And it will be based on one of those four components: social awareness, social cognition, social communication, and social motivation. Now that's more technical understanding of socialization, and I'm going to break down the skills or tools that you can use to help your kids. So I'm going to talk a little bit about the big ideas of socialization, then we'll transition to some of the barriers that inhibit the opportunity to socialize, and then what are some of the foundations necessary for socialization. And then consequently, we'll talk about some specific strategies that parents can use to train their kids. I want to introduce you to an actual superhero. This is my mother. When I was young, I had some learning challenges that were pretty significant. And rather than rely on other people to close that gap, my mother coordinated my care, and she made sure I got all the necessary instruction. In fact, it wasn't until at a later time that I learned that Saturday was actually a holiday, because my mom would have me doing tutoring every Saturday. So I'm a big proponent of not only early intervention, but a wraparound approach. So my mom believed that, yes, you go to school. She put me in a special school where there were learning needs, and she gave me additional instruction, read to me. So all these things contributed to my success. And 4 degrees later, I'm not doing too bad in the academic arena. And that's just a testimony for families like you who have committed to your kids' welfare and not just relying on providers or educators, because it really is a wraparound approach. So I take the treatment and care of families very seriously. It's a personal goal of mine, and it's also passionate. So I enjoy working with families, and I definitely enjoy watching the growth that I see my patients undergo from, when I initially met them with struggles. So kudos to all you parents out there that are attending this presentation. So let's start with just a basic understanding of what we understand on the value of social skills. We know that children who are socially skilled spend more time on tasks, more apt to help others, can advocate for themselves, and can problem solve better, right? I was just testing a patient of mine, and while I was having him do these blocks, I showed him a picture and he had to build these blocks. And as he was building it, he referenced me and he looked at me and said, "Hey, Dr. D," because that's what kids call me. He said, "Dr. D, shall I turn my blocks around so you can see what I'm doing?" Now, in my books, that's a pretty significant social skill. He could take my perspective, and he was empathetic in realizing that if I was going to watch him do it and grade him on it, that I needed to see it completely. So I was really impressed with him and actually commented that to his mom, who was pleasantly surprised because she didn't think he can do such things because he doesn't do it with her. And I told her, I said, well, the good news is he can. The bad news, he just has to practice. And that's what you're going to see with a lot of your kids. Your kids have inherent abilities that you may not have tapped in enough. So towards the end of the presentation, I will give you some really concrete skills that you can practice with your own kids. So let's talk about what social conventions are. Social conventions are basically the rules, procedures, and methods we use to conduct ourselves, etiquette, manners, things like that. The problem for kids is that in today's society where we have so much diversity and so many different rules, it makes it really hard for a kid with social skills to understand the dynamics. So think about a kid that may have challenges. What happens when you're faced with a social anomaly? You're not cognizant of a pre-established rule, and you can't recognize or identify a reasonable substitute or retrieve from your memory a previous interaction. Remember, the challenge for kids with social skill challenges is that they have about 3 to 6 seconds to respond. Now, many kids, if you give them 20 minutes, they'll do a great job because they can think it through, they can extrapolate the information, and then they can make a good decision. And if a parent is wrong, you can modify that interaction and clean it up. Unfortunately, kids don't get that luxury. Things happen really fast in social interactions. I mean, in my example there, when you asking someone, greeting someone during the holiday season, do you say Merry Christmas or Happy Holidays? A kid without enough social awareness may not know that not everyone may celebrate Christmas and consequently may come across as offensive, which in many cases, that's not the case with our kids, right? And what we know, basements and electronics become a sanctuary for these kids, especially as they get older. I'm treating several college-age students who habitate in the basement because it's a safe place. They're not scrutinized, they're not judged, and they don't feel uncomfortable. But unfortunately, we need to get them out of it, out of the basement, away from the electronics, and actually engaging with people face to face. But we can't readily ask kids to do that unless, you know, we give them the tools and the motivation to do so. So our job is really to teach kids. I always tell parents when we first begin, have a disclaimer with your kids when they act inappropriately or socially awkward around others. Just make an apology. It says, please excuse my child. It's socialization in progress. And I don't know any decent person that wouldn't say okay and accept that, you know, you're working on it. Even if your kid throws a tantrum or meltdown in a store, most people are empathetic to your cause. So let me give you some examples of where social skills can go array. So I was working with a child who was stressed out because of just the difficulties associated with having 3 disorders. And, you know, I was trying to explore ways that this child could seek comfort. So I used me as a reference because I was sort of like a mentor to this child. And I told him, I said, you know, even Dr. D has pleasurable things. And I mentioned a modified competition BMW M3. Now I underlined the word modified because that was a key word in what I was emphasizing, that I enjoy performance cars. Of course, my patient, because of the autism, overlooked, and because of the ADHD inattentive, overlooked the fact of what I was trying to say. So he took the conversation and hyper-focused on the BMW part of my statement rather than the modified part of my statement, and referred to it as a fancy car. So I went along with it and I said, well, not faster than my M3, trying to emphasize to the child using intonation that my car was different than a typical M3. But of course, that kid hyper-focused on his line of conversation, continued to focus on what he was saying. So basically, we were having this parallel conversation, and this oftentimes happens with kids with social skill challenges, right? And they don't engage in this reciprocal conversation. So because the parent was in a room, which I often do, I keep families in a room so they can learn my skills and secrets on how to help kids. She adequately and readily corrected him and redirected the conversation so he could understand what we were trying to say, right? And this is an important tool. Rather than punish kids or reprimanded for their mistakes, is to teach. And that's going to be a big emphasis in what I discussed today. It's all about teaching skills. Here's another example of a kid with a social skill challenge. This is more with semantic language error and a way of a binary thinking. I had a patient, the family and I were in the room, and she went to the restroom and she came back and said, I just satisfied my bladder. Now, of course, satisfied is not used when you talk about your bladder. But again, this is a social communication error. So I went along with it and I asked her if she meant she relieved her bladder. And then I made a joke. It's not like you gave your bladder a lollipop and your bladder was satisfied with the lollipop. But of course, because she couldn't take that perspective, she was flabbergasted or appalled that, you know, I was thinking about sticking a lollipop up her vagina, right? Now imagine if this did not happen in the safe haven of my therapeutic room with her parents, how awkward this could have been, right? But for me as a teacher and as a coach, I redirected her and clarified by asking her that question is, what did I mean? Too often people want to correct kids with social skill challenges. And really what you want to do is encourage them to rethink what they said. That way we can probe to see if with some more additional information or prompting, if they can figure out that social dilemma they put themselves in. So what do we know about social skills? Well, we know from infancy, kids start developing early signs of social attachment. And if there are any shortcomings in this typical trajectory of development, kids are going to start having lags or gaps or delays in their social skill abilities. For instance, we know infants at birth, they start making eye contact with their mother during breastfeeding, and your vision, you have vision acuity for about 6 to 10 inches, which is right where the bosom is to the eye. So that's an evolutionary process to initiate the connection between a caregiver and a child. We know at a very young age, kids do a lot of social referencing. We see this when kids are injured and they look or scared, and they look towards their caregiver on how they should react to this situation, right? We know kids experience social anxiety, and although this may be distressing for them and their parents, it's actually a normal trajectory in their development. And what that tells us is that these kids are already having social connections with caregivers. We know kids as young as 1 year of age, they have stranger anxiety. What does that mean? Well, in the presence of a stranger and without their parent, they get scared or anxious. We know infants can do deferred imitation. What does that mean? Well, it means that they can, if you stick your tongue out at a baby, they in turn will stick their tongue out. Later on, they will continue to do that. These skills are the precursors for good social skills. And in the absence of the development or acquisition of these skills, what we see is that kids then have subsequent delays in other social skills. All these skills are precursors for taking perspective, empathy, reciprocal conversation. So one of the things I emphasize a lot in my practice is going back to the basics and retraining these skills. For instance, social pointing. Social pointing is a huge component of later onset of perspective taking. When you point at something, you're asking the kid to shift from their attention to your attention. When a kid then points at something, that kid is asking you to pay attention to me. When kids do not do this enough at a younger age, the challenge for them is that they aren't able to then later on take perspectives in conversations or conflicts, and that's why they get rigid. So one of the things I do with even teenagers when I work with them, and they may be on the spectrum or they may be ADHD or have a mood disorder and their socialization skills are limited, I go back and just teach the basics to make sure they have that foundation. Another one is joint attention. What do we know about joint attention? Well, when you have joint attention, it encourages you to use language to describe what you're paying attention to. It helps foster shared interests, and it also builds trust in other people. And kids, especially on the spectrum, right? And I use the word spectrum because it ranges, right? No kid is alike on a spectrum. But without joint attention at early ages, this is a really hard skill for kids to use when having any kind of conversation at 8, at 15, at 25. So one of the things, especially for you with for you parents with young kids, is to really hone in on the joint attention and pointing and close these gaps. These are some of the hallmark features I look for when I diagnose autism at a young age. Play. This is a huge component. A normal trajectory for play is functional play, where kids play with a toy appropriately. So a child will take a car and drive it back and forth, right? What we see with some kids at a young age, they might hyper-focus on the wheel of the car and just spin it. That's not functional play, right? So that's what we call restricted play. Pretend play is where you take something like a pen and you use it as an aeroplane. And one of the things I look for when I'm just engaging in a semi-structural or informal play interview with a child is I look for functional play and pretend play. That tells me a lot. And in the absence of it, I tell parents, I'm not interested whether your kid is 10 or 15. We have to go back and use functional play and pretend play, just more developmentally appropriate, of course, but nonetheless, we still have to help these kids learn how to play. It's not uncommon to see in my hallway me running with a kid or going outside and using sticks and stones to just make up these games. Because what we know, when kids on the spectrum or kids with any other significant disorder, when they engage in play, it's really hard for them to wait their turn, problem solve, or follow rules. They want to do it their way, right? And joint attention, again, at an early age, then becomes a basis for enjoying play later on. So the big idea here is that we got to go back to the basics. When you're working with your own child, especially during these times of COVID, and you have more contact time with your kids, you want to see what their ability is to do functional or pretend play, and then go back and do it, even if they're 8 or 10 years old. Don't try to put them in sports. People make that recommendations, but if you don't have the social skills to play sports, it's really hard. And then consequently, what happens is parents feel defeated or discouraged. Your child may react or resist the opportunity for them to play a sport. So I always tell parents, before you take them into a sports arena, make sure that they can do pretend play and functional play, and do it with basic stuff so they can enjoy it and they don't feel overwhelmed. Because quite frankly, they have an inability or a restriction in being able to do this. So what do we understand about some of the difficulties with social skills? We know there tends to be a significant communication gap where they may have difficulty understanding things like idioms, like it's raining cats and dogs. We know prosody is an issue, and I'll talk about that shortly. They have difficulty with making good eye contact or using inflection in their voice to communicate a meaning. They may do what we call pedantic speech, which a good definition is, when professors talk to students at the university setting, they talk in this very structured way. I had a patient just recently, when I asked, his mother said he had autism. So I asked the kid to engage him. I says, what does autism mean to you? And he got into this long-winded lecture about the diagnostic criteria for autism. And even though I interrupted him several times and gave him several inflections and redirections by saying, what does autism mean for you, right? Things like that. He still kept giving me this long-winded lecture about the diagnosis of autism. And kudos to him. I think he knew the diagnosis better than me, right? But that was not the question, and that was not the engagement. And these things can be off-putting to people that are listening. We know that there are difficulties with with appropriate facial expressions and gestures, and that they may miss some of those miscommunication cues. Or kids might hyper-focus on keywords. I had one patient that got into a tangle with a teacher because the teacher told him, please do the odd numbers in your math quiz and then come to me and I'll take a look at it. Subsequently, when the kid came back thinking he was done, the teacher says, now go back and do the even numbers. And he threw a massive meltdown. And the teacher saw it as a discipline issue. And I had to consult with the teacher and help that teacher understand that, no, this is a conversation, a communication error. Because he literally thought you only meant do that and that was it. So when you have communication errors, it can be a big barrier to engaging successfully and finding meaning in communicating or socializing with other people. We know kids with social skill issues also have nonverbal communication errors, and I've alluded to that already. They may have limited in abilities to greet and say goodbye to people. I have kids on the spectrum that may just bulldoze past me when I'm taking them back to my office. But what a great opportunity for me to then teach them. So I might spend the first 15 minutes of the sessions just teaching them how to greet and say goodbye. Because kids, in my opinion, kids tell us how to help them, how to fix things, how to heal them, how to improve things, how to correct things. So I'm always looking at the kid to tell me what they need. We know that they misinterpret facial expressions or may not use good body language. And these are all things that we have to be mindful of when we're working with kids with social skills. It's not that a discipline issue, it's a teaching deficit issue. And consequently, what we want to do is help them close that gap. So prosody is a big component of social skill learning. A friend says, I love you, but means I love the fact that you agreed to do something for me. And with this miscommunication, it can be very confusing and frustrating for a kid with limited social skills. I know the word in this one, a classmate says, are you really done? The word really can have so many different connotations based on how much tone and emphasis and inflection you put on it, right? And oftentimes kids with social skill deficit, especially those on the spectrum, may have a difficulty with prosody. And that is something that speech pathologists do a great job in teaching. But that doesn't mean you can't do it as well. You can use the word really in different contexts and teach it. Because here's the deal, folks. Prosody is not something that we learn directly. It's subtleties in our language that we learn from observation and imitation. If your kid at a young age did not develop the skill of deferred imitation, it is very unlikely that later on they would develop the ability to use prosody adequately. And that's why I'm a big advocate for going back and teaching the basics like imitation, so that I know it will be easier for me to teach them prosody. So let's talk about some pragmatics. Pragmatics, there are two components of language, semantics and pragmatics. Semantics is the meaning that you're conveying. Oftentimes, kids with an enriched vocabulary, like we see with many kids on the spectrum, they have a high verbal IQ, but they don't have the pragmatic piece, which is the ability to make inferences. And I've provided some examples of where they may go in error. He was trying to get in front of the line when the kid was actually just standing next to the line, right? So making inferences means the ability to read between the lines, literally. And in that, it means in what the person is saying and what the person is meaning, right? Interpersonal negotiation. Kids oftentimes may have difficulty in understanding how to negotiate with other people as a problem solver so that it's a win-win situation, right? And they may only seek out what they want. Multiple interpretation. I have a kid I'm working on now, and when I tested this individual, he has difficulty in seeing multiple sides of a situation. That's part of being a bidirectional thinker. Most people are bidirectional thinker, where we can see different perspectives and then account for that. Kids on the spectrum especially have difficulty because they're binary thinkers, meaning they're either 0, 1, yes, no, right? There are no grays like maybes, perhaps, but of course, the exception, they have difficulty with those kind of concepts. So a child might say, my teacher's mad at me no matter what. Now, keep in mind, anxious kids always also do this. This is why this presentation is with a strong emphasis on autism, but other kids show social challenges. And I want to make sure, in fairness to everyone, that we capture that social skills can be taught to all kids. Supporting cares. One of the things you do with pragmatic skills is to support peers. So a kid who has a bad hair day, a kid with limited pragmatic skills might say, what happened to your hair? Versus another kid with really good pragmatic skills would say, your hair looks nice. Different, but nice. That's a nice politically correct way of acknowledging something different, so you don't make the other person feel uncomfortable. Or supporting peers would be not mentioning the hair because it looks different or atrocious, and a kid with good pragmatic skills will know not to say something about it. So what do we know about social exchanges? This is a nice keyword that I use quite often, right? Social exchanges. We know that kids with difficulty with social exchanges will have what we call a linear conversation. I'm so hungry. And then the second kid takes that cue or prompt and says, oh my gosh, I am more hungry. Now, I see this a lot with teenagers because of their own egocentric ways. And I'm sure for you with you folks with teenagers have seen that. It's a little bit more complex with kids with social skills deficits. They tend to do this too often. A good reciprocal conversation is what a dialogue here. I'm so hungry. What do you want to eat? I'm not sure, but maybe a hamburger. That sounds yummy. With ketchup, but no mustard. Well, I'm starving too. And this is where the second kid, after completing the dialogue about what that first kid's needs are, then transitions appropriately to what his or her needs is, right? And then they go. This is joining, and it's a shared interest, and then subsequently a shared enjoyment of a meal. And in the absence of this, there's a lack of an opportunity to engage someone socially and enjoy them. And as we all know, you know, like with Thanksgiving coming up, eating together is a big part of socializing and learning social skills. So I would encourage you to use social exchanges and start stretching your kids' ability to engage in a reciprocal conversation rather than a linear conversation. I do this all the time. I have kids come in my office and I said, how was your day? And they always guarantee say, good. So then I stretch that. Well, how do you think my day is? I don't know. Well, guess. Good. I says, not really. Look at my face. And I would put a sort of like sad face on. And it says, you have to look at my face to see how my day was. But that's a reciprocal conversation as well as me teaching a reciprocal conversation. So I'm doing two things at once. But I'm stretching the social exchange between a child and myself, right? But in fairness to the kids that, your kids and the kids I service, we have to understand a few things about kids that come, especially at a later age. Limited social skills actually become functional to them because they don't want to be punished or marginalized, right? They would tell me, I'm afraid to talk. I don't know how to. Kids are mean to me. I know many kids that are on the spectrum with ADHD or anxiety, for instance, and they are bullied or teased or rejected, and they have learned to adapt to that. Should they have to adapt to that? No. Do they do it? Yes. And what you tend to see is they engage in a lot of parallel play. And that's one of the things I do when I do assessment. I try to go to the school and watch that kid interact at recess on the playground. And what you will see, especially with girls, we call them the great pretenders in the field of autism, what you will see is that they kind of stand really close to the other kids, but they're not really engaging. But you have to look for a long period of time to see that. Because what they're trying to do is fit in, but without necessarily fitting in. And like I said, you know, kids also adapt, meaning they develop scripts or greetings so they can look like they fit in. I have one 22-year-old that I'm working with, I just started, and she says yes a lot. So I'll be talking to her and she keeps going, yes, yes, and she's really good. She has some pauses in between it. She changes her facial gesture, or, you know, so it looks like she's listening. And after a while, I notice a pattern within her adaptive script. And I asked her, what did I just say? And she went, yes. And she really didn't understand what I was saying. And I caught on to it and I pointed out to her parents and I says, we have to remove that word from her vocabulary because that word is adaptive and it's really going to interrupt our ability for her to take a risk, a healthy risk, and learn new ways of social exchanges, right? One of the most frustrating things for parents is when their kid has the ability to engage in appropriate social exchanges, but don't apply it. And I see this often. I had one father who used to say, my friend, his son was the best 5-minute friend in the world. And he says, you have to wait for it, and then you'll see that kid sort of like ruin that social interaction that started off for the first 5 minutes is really good. The kid would be in the waiting room and we'll go up to another kid and greet them and ask the kid what they were doing on the video and ask a question. And you would think, wow, this kid really has some good social exchanges. But then 5 minutes later, the kid is grabbing the computer game and saying, it's my turn now. You played with it long enough. Not understanding personal boundary and that's not his electronic, right? So let's talk about some of the things we want to focus on when we build social exchanges, because the whole premise of social exchanges is to not it's a tool for relationships. And if kids don't have that tool to build relationships, then it's really hard for them to value it, despite your encouragement and your incentives to do so. So that's a big component of social skills training, is to foster relationships. That's what I do with my kids. I build a relationship with me as a mentor and as a friend, so that they can see the value in their efforts and the rewards that it gets from engaging with me in social exchanging and being successful. And like I say, I keep families in my room so they can see me, because I struggle, right? I struggle with it because my patient has challenges. But then throughout the session, the parent is also learning on what they need to do and that to persevere. That kids can't learn social skills overnight. It's like reading. When teachers are frustrated with kids' lack of social skills, I always gently remind them that just like reading, which took years to become fluent, social skills is the same way. And there's certain pathways that kids must follow, right? And if they don't follow it, then they won't learn to socialize appropriately. So these are just some of the things: taking turns in conversation, using manners, joining play that already is started. And you can see that one on the playground, right? A parent pulls up in their minivan with their kids, hauls out all 16 of them, and the kids all rush to the jungle gym, and they just kind of jump into the flow of the traffic as the kids are running up, across, and down the jungle gym. And these kids just jump in, versus a kid with some social skill challenges who will stand by the jungle gym, rub the pole, seek shade from the jungle gym, but really won't engage in the play activity with the jungle gym. So these are some of the tools that you want to teach kids to do, and you can't do it unless you have direct instruction. And that's the beauty of applied behavior analysis, right? Those clinicians, they work with this pretty aggressively and intensely to build these skills. And then for someone like me who specializes in social skills training, then I sort of trim it up and generalize those skills to more natural settings. So one of the things you can do with your kid is to grade their social exchanges, especially as they get a little older, right? 6, 7, where you can actually give them points for it. And you can start small. I had one kid where an A was just smiling at me. But as kids get older, like if you're working with a teenager, these are all some of these social skills that would warrant an A, right? And a B would be some of the skills, C would be a little less of it, D would just be not to interrupt. And the E is not a failure, it's just try again, you're only a kid. And I tell kids this all the time. You're not gonna harm a kid if you give him an E, if you give that kid a way out, right? Now, if another kid on a playground is mean to a kid and says, oh, you're not good at being friends, you know, I can see why that may hurt a kid or traumatize a kid. But for me, I want them to understand there is a range of skills, and my job is to help you. So I use grading quite a bit when I do social skills training. And you can do that and make it a fun thing. I've had kids, Dr. D, did I get a B this time? I'm like, no, it's more like a C+, but let's try again. Or you want to quit. And kids never tell me they want to quit. Why? Because I empower them and they know that I'm teaching them. And they value the need to learn that skill. So they says, yes, let's try for a B. I said, and then I put a disclaimer, right? Because this is part of the exchange with them. You may only get a B minus. Will you be comfortable with that? Or you want to try for a B? And that's part of that interaction and part of that social motivation I'm fostering in them, right? That not everything is perfect, but effort and teaching is the key to success. I do a lot of what I call social associations. I ask them for elaboration because kids with limited social skills don't communicate effectively. So what you want to do is to ask them more, to encourage them to reciprocate, right? Not a linear conversation, but a reciprocal conversation. You want to encourage them to do more. Most parents are like Jedis. They can read minds, right? Your kid says, "Mommy, I'm hungry." And you know they want that peanut butter jelly sandwich with 2 slices of banana, not 3, 2. But that doesn't encourage good social communication. So I stretch it. I says, "You said you were hungry. What do you think you want?" And they would tell me peanut butter. And then if I was to make a sandwich with just peanut butter, they'll have a meltdown. Well, I'm like, no, I hold them accountable. You have to explain yourself. So in some ways, you're sabotaging their speech, but you're sending them a strong message, which is there are consequences for the way you communicate. So I have the banana and the jam ready. So as soon as they get frustrated that they didn't communicate with me, I says, "Well, tell me more." And then they tell me I want 2 slices of banana and 1 spread of jam, not 2. And then I do it for them. And guess what? They learn the value that communication is essential for getting their needs met. Good parents, what they do, they just read their kids and do things for them. And unfortunately, that doesn't help them later on in adolescence and when they go off to college or when they live independently. So elaboration is a key hallmark feature of social exchanges. Scaffolding. Kids with limited social skills tends to be flat in their conversation, and we want to add flavor. I'm sorry, I'm from the Caribbean, so I believe in flavor. And the way I do my therapy is very flavorful, very dynamic, very engaging. Like I said, it's not often that you won't see me running down the hallway. We do track and field in the hallway of my office because I have this long hallway. It was perfect when we bought the place. And the first thing I thought is like, I'm going to have races against kids in that hallway so I can teach them how to win and lose gracefully, right? But with scaffolding, we want to have them make comments and ask questions about what you say. And I would ask them that, what do you think about what I just said, right? And I encourage them, even if they don't have an answer, I may give them an answer. Remember, teaching is also providing direction and even concrete answers, because kids may not readily have that ability. Carryover conversation, this is really important. Don't just have one conversation with your child. Have the same conversation several times, because then they can build on it. They get more comfortable. So if you're talking about Pokemon, for instance, or baseball cards, start the conversation today. Put a post-it on your nightstand that you will have that conversation with your kid again and build on it. So that kid has what we call a social cognition of that social exchange with Pokemon. And that builds their confidence because they get more fluent and more comfortable with one topic of interest. And that's another way to build. I can't tell you how many incomplete Legos and drawings I have that I keep adding to it the next time I see my patients so that we can continue our conversation, right? Because you don't go to the gym in one day and get the body you want for summer. It takes a lot of vigorous work on multiple days. So I use the same carryover principle with exercise I apply to social skills training. You can do so as well, right? You can start making cupcakes with your kid and take your time, make sure there's social engagement, and then you can stop it, put the batter in the fridge, and then come back it tomorrow, review what you discussed and what you covered in baking the cupcakes yesterday, and continue tomorrow. I like successive approximations of communication, and this is where the emphasis is on teaching. I had a patient at a school, and we were in a meeting, and he came in, and I put Brandon in quotes because that's not his name for confidentiality. So Brandon came in, and the principal asked him, how are you feeling, right? And we were all curious and how he's feeling, and he went like this, crappish. And I said, what does that mean? He says, well, I'm not happy or sad. And he said, I see what you mean. Is there another way you can say it without getting in trouble for, cursing? And he said, I don't know. So imagine if that principal, if I was not in the office with the principal, in fairness to the principal, right? We can't use such inappropriate words, but in fairness to Brandon, he doesn't know another word, and it is our job to teach him, right? So I spent some time teaching him what would be an appropriate way or middle ground between happy or sad, other than this, even though that was a really good gesture, right? At least he had that skill. So I took this and I scaffolded it to put a word into what that would mean, right? So let's talk about some other techniques. One of the things we mentioned earlier is that kids with social skill deficits, especially kids with autism, those with high IQs or high verbal abilities, they tend to kind of have this pedantic way of having a conversation, right? And I always give kids cues. So a lot of these things that I'm talking in this PowerPoint here will be cues, right? Summarize your story, right? Give me the big idea, Jeffrey, about what you're trying to say. Lisa, rather than tell me about everything you do about the makeup, just tell me the things that you think I would be interested as a guy about knowing about makeup, rather than everything, right? Information sharing, again, consistent with what I just said with summarizing. Too little, just write too much. And I like to use this because I want kids to be more cognizant or socially cognitive aware of how their conversation is impacting others, right? Rather than punish kids for the mistakes they make with the grammar or the verb they use, I ask them to rephrase that statement. How can you say it better? What are you trying to tell me? Keywords like that is very essential to give kids in the moment a second chance to do it right. That fosters a lot of motivation and confidence in them in that they can. Teach kids to show gratitude and appreciation. People would treat them nicer. I had one kid on the spectrum. He had so much social motivation. His scores on that were like up here. He was smiling. He made great eye contact. He just couldn't hold a conversation for more than 2 minutes with people. So he went around and greeting and saying something nice to each person. But he was very lonely and isolated because he couldn't continue to foster a friendship. But even though he was on the spectrum, he had this really high social motivation. And that ties into the fact that oftentimes kids on the spectrum have a range of abilities, and it's absolutely important that you understand where those skills are in terms of strengths and where they are in terms of needs. One of the things I encourage parents to do is to go online and show different videos or pictures and use these naturalistic observations, or even in real, right? And ask them to describe a social situation. So if you're at the food court in the mall, you can ask your child, you see that family over there? What are they doing? Can you describe what they're doing to me? So that's them telling a story. Well, the baby's eating, it's drinking a formula, and mom's eating a Subway. That awareness is very important. And guess what? It's natural, it's not artificial. And as parents, you can do that in these natural settings as you enjoy lunch at the food court with your kid. What just happened? Well, the little boy dropped his sandwich. Well, will he be sad or happy? Remember, don't just rely on educators and providers to do this, because we don't have access to your kids like you. You're like 7-Eleven, 24 hours, 7 days a week. You can do so much for your kids, right? So take these opportunities to enhance what us as providers and educators are doing, but just with a limited time. Let's talk a little bit about social awareness. This is what one of my 8-year-old patients saw me as, right? And this was quite a success, because when I met this kid when he was 8, and 3 months after treating him, this was how much social awareness he had. He had a very good description of me, right? But at 3, the providers that were treated him told his parents that he will never talk and he will always need assistance. But this kid, these parents were one of those official superheroes. They were like, oh, hell no, my kid will do better. And it was amazing. When I met him, he had been in OT, speech, ABA therapy. he had come a long way. And my job was to now trim it and make sure that he can generalize all those skills. He can generalize it in more natural settings. So I was more of a coach, but this is how he saw me. And that was really good because it was a fairly accurate description of who I was. I was non-threatening. I was facilitating. I didn't have any arms, and we talked about that I needed arms so I can give him high fives. And you saw how I scaffolded on what he had drawn because I wanted to see me as a whole, not as a part. Because one thing we know about kids, especially on the spectrum, it's easier for them to see objects than they are to see body shapes, especially the face. So I had him draw me with some arms and 10 fingers. He drew me with 8 fingers at first. And I didn't criticize him. I said, let's try again. And I showed him my fingers. How many do I have? And he went, oh, I'm sorry. I said, don't apologize. Just give me 10 fingers so I can count to 10. Let's talk about physical touch because this is often neglected. And why? Because many kids, especially on the spectrum, they may have sensory processing challenges. And I like to call functional equivalence. And basically what that is saying is that we have to kind of go back to some of the basics. Make sure you give a lot of comfort contact, gentle touching. I know a lot of the OTs do a lot of the brushing, right? And that's great, but parents can also do more. You don't necessarily have to just do brushing. You can just do some of the more natural, more typical physical touch, holding hand, right? Touching like that, a pat on the shoulder. Smart touch is when I use that quite a bit when I'm encouraging kids. I'll put my hand on their shoulder and I'll tap and it says, keep working on that worksheet. It's looking good, right? If they're not looking at me, I would take my hand and put it on their chin and direct their gaze to me, right? That's a smart touch. If they're stressing out in doing a workshop, a worksheet or an activity in one of my groups, I'll come up behind them and I will massage their shoulders and says, hey, let's work on just being calm. Don't look at the smart board. Let's just work on being calm, okay? Using I like you and I love you more. Let kids associate that with your words to them with trust. Very important. Remember, kids that have difficulties with social skills have also a difficulty with seeking any kind of attention, any kind of nurturance, receiving that and responding to it. I have kids that come into my office and I pay them a compliment and then they say, no, I don't like that. I would say a kid, wow, you're like a Jedi, you're pretty smart. And they'll get upset with me. And I have to explain and walk them through that that's a compliment, right? Social smiling. This is a huge component, right? We actually have neurons or brain cells in our body that are used, and they're called mirror neurons. They are actually used to help you imitate other people. And what we know that some kids, especially on the spectrum, may have deficits in the amount of these sorts of brain cells. And what we want to do is stimulate the brain to grow more or make better connections with the ones they have, right? That's called neural connections. But social smiling is huge. Oftentimes, this is one of the baselines of where I start with my treatment. It's just getting them to smile at me because you have to make eye contact with another person to smile. And it's contagious, right? We know that smiling is contagious, but it's also a signal to safety and an invitation to connect. And that a social reward is likely pending, meaning you will enjoy that exchange. So let's practice. I have, with my families, I teach them this skill. Every time your kid kind of smiles or maybe looks at you, smile. Let them see that, right? Catch your child doing something they like and smile at them. That teaches them that smiling is associated with validation. And many kids, especially on the spectrum, they may not have that connection. So we don't get to reinforce them and connect with them over time. Keep in mind that when we talk about social skills is not a one-time event. It's hundreds and hundreds of opportunities to have a social exchange with another person, especially as a caregiver like yourself, and find value in it and learn the skill, right? When your child catches you doing something, you smile. So if a kid looks at you and you are washing dishes, you smile and says, I like washing dishes. Here, watch me, right? Get them connected. Smiling is a huge part. Look at your kid as compared to other kids, and you will see that they probably smile less. So if you can foster this in them, you are ahead of the game. You're getting them ready so that their educators and providers have more time to work on more advanced social skills rather than the basics. And quite frankly, this one is often overlooked, right? I had a patient that came in, and the kid is a high functioning autism and apparently depressed. And I told the parents, well, you know, those are two big words, but how about if we teach that kid to smile? So I spent the whole session teaching that kid to make eye contact with me and smile. And then the kid left and says, Dr. D, I don't feel as depressed as when I came in. I says, well, that's a step in the right direction. We'll practice it more at our next session. And then I winked at the parents and says, and you're going to do it at home quite a bit because you are the game changer. You are 7-11, 24 hours, 7 days a week, right? Except when you need a break. Let's talk about social emotions. They're basic emotions, and most kids are able to, in some degree, adequately identify basic emotions such as happy, mad, sad. It's the social emotions that come at a later age, like around 6, 7, that kids really have a hard time. And that's where we see kids develop those social deficits, right? Not being able to identify what frustration and disappointment are. And this can be very difficult. In fact, the irony of this slide is that yesterday I got schooled by a kid that was high functioning because we were talking about disappointment because he was wiggling a lot. And I said, you know, if you keep wiggling, you're going to disappoint your mom because she's watching at you. And I referenced her face. I says, look at her face. What's that telling you? And he said, she's sad and mad. And what a good schooling, because that's really what disappointment is in a very physical, semantic way, right? So he's really good at tuning a definition of what disappointment. But he was not able to understand that disappointment in his mom towards him is a belief that he can sit still, but he did not do it at this time. So she was disappointed in what he was not doing. So we spent a considerable amount of time in session teaching him that disappointment is how someone perceives you and how you may betray them or not do what they did that makes them sad or frustrated, right? So these are some of the things you have to catch. And one of the things we emphasize when we teach social skills is to help kids understand different social emotions. It's a very integral part of being able to connect with others, right? Social emotion is a hallmark feature for empathy. Without social emotions, then it's really hard for you to empathize with others. Here's a great way to teach kids about emotional expression in others. You can show them pictures like this and says, what is that person feeling? What tells you what that person is feeling? And what could the person be thinking given that feeling? And what will this person do next? But folks, remember, when you do this, you can't do this once or twice. This is something you have to do daily. In some ways, the COVID has been really good for some of my families because my families have a lot more contact with their kids, and the parents have been charged with being an educator, a provider, and a parent. But these are highly motivated parents that see me, and I've been giving them my tools, and they've been drilling their kids. So now that I'm doing in-person sessions and these kids come back to me, I have seen quite admirably the gains they've made because the parents have been doing this homework. They're not just relying on providers or educators, because this is really a team effort, and it's all about teaching. So you can go on the internet and get pictures and just set it up and spend about 15 minutes. And don't be dismayed if your kid is unable to do this well. Remember, we are teaching them, not disciplining them for lack of ability, just fostering what limited ability they have and moving forward. Let's talk about cognitive flexibility. Yes, we know all the parenting magazines talk about creating a predictable structure for kids because it's actually healthy for them based on the way the brain works. So structure is essential to kids' development. I'm not disputing that. What I'm saying though, however, for kids that have social skills difficulty, We want to use routines as a teaching model or platform for getting them to be flexible. So what we might do is just alter that a bit, right? Instead of brushing your teeth before bed, before you put on your pajamas, you might switch that around. It still gets done because, as we know, especially kids on the spectrum, they have tremendous difficulty breaking from their structure. And cognitive flexibility is an essential piece of social exchanges because there's no script. It's very dynamic social exchanges, and without cognitive flexibility, you will stick to script rather than evolve. We talked about asking clarification questions, very important. Always make sure kids understand what you are asking them, expecting them to do, or prompting them to do. To give you a peace of mind, and I'm sure many of you know, give kids advanced warning on changes. Help kids be a language detective, right? Am I joking or serious? I do this quite a bit. I ask kids, am I joking? Was I joking or being serious when I made that comment? And I help them walk through the process of learning that distinction. Practice flexibility. Here's a fun one that you can do if you want a good old fight with a kid. Tell them, let's go Dunkin' Donuts. And they get all excited and they're driving to Dunkin' Donuts. They've already visualized the jelly donut they will consume, perhaps 2 or 3 if they can convince you. And then as you get close to Dunkin' Donuts, say, never mind, let's just go home. Now it's on, right? You just created World War III. But guess what? That's a great opportunity for them to practice flexibility. And you know what, parents? I would rather they do that with you than they do that with a teacher that is trying to teach them a different way to approach a math problem where they may throw a fit, right? So it's okay if you practice flexibility. My recommendation for parents when they're doing it is take 2 Advil, drink a Red Bull, and turn your phone off and let it happen. Let's do this instead. Never mind. That's okay. Excuse me. This is a nice book that helps kids with teaching flexibility. And even if your kid is 10, you can still enjoy it because the message is still the same, right? I wouldn't recommend sharing it with a 16-year-old, but you know, the message is still consistent with what flexibility is. Let's talk about personal space. This is a big component of social exchanges, right? And it's not just about standing close to someone or not close to someone. It's being socially aware of other people's comfort level. That means you have to take the other person's perspective. So if I'm working with an anxious kid, sometimes I will be really close to them to show that moral support. Or some other kids that are anxious, I will move back. Now, how do I know when to differentiate whether I move close or whether I move back? Well, that means I have to have very good personal space awareness. And you can teach kids this. There's a book I'm going to share now, My Personal Space Camp. This is something good because don't look at personal space as just a physical boundary. Look at it as awareness that there's someone else that I'm having a social engagement with. And consequently, I need to be mindful of them. Perspective taking. This is another hallmark feature of good social skills. And remember, if your kids don't have these, what we call these prerequisite skills, perspective taking, personal space, personal touch, social smiling, it's really hard for them to engage in a social story or follow a social skill curriculum that, say, a speech pathologist, a school psychologist, a teacher, school counselor, psychologist will use because they don't have the prerequisites for understanding that instruction. And that's one of my frustration in looking at a lot of social skills curriculum is that they're not giving the kids the prerequisites so that they can understand. It's like trying to teach a kid to be fluent in reading who does not have good phonemic awareness. They don't know that B is ba. So when they come across a word with B, how are they going to be able to say that word? They won't. So they will struggle with that word and consequently their fluency will decrease, right? Or they'll need more time to sound out the words. And it's the same thing with social skills. If you don't have perspective taking, it's very unlikely you'll be able to efficiently have a good social exchange, because as I mentioned before, social skills require a lot of dynamic and on-the-spot changes. So perspective taking is really for how everyone sees something, and the ability to empathize, which is a more complex social skill that kids develop more in adolescence, right? In late childhood, they will have difficulty with this. So here's an example. Lisa got an ice cream after going to the dentist, and that's not fair. So I had a patient, her name's not Lisa, but she came in and she was furious because she did not get an ice cream. So I asked her clarification, why is it bad if your sister got an ice cream? Of course, I said more. I says, wouldn't you be happy that she's getting to enjoy something creamy and sugary? And, I even asked her, was she smiling when she had ice cream? And she says, I don't care. And then she said, because I did not get one. I said, so you were disappointed because Lisa got an ice cream going to the dentist? Even if you don't go to the dentist, you should get one? Yes, and it's not fair. So there's that rigid way of thinking, right? If I want an ice cream, therefore I get an ice cream, without the social context that her sister actually did something to get the ice cream. So this is really hard for kids to get. And, you can then focus on disciplining them or ignoring them, but then that's an opportunity missed for them to learn, because they're going to take that lack of awareness to their adulthood. So imagine what a kid like Lisa, not Lisa, my patient would look like in the work context. It would be really hard for her or him to navigate social difficulties where, in the context where she or he feels that they've been jaded or things aren't fair. And as adults, we do a lot of compromising. So a kid with social skills deficits that cannot compromise, especially when you have a boss or an employer, that is not that's a game changer for employment, right? So let's practice. What I like to do is I ask kids, I use what am I thinking when, and these are some examples. You do not tell me good morning. What am I thinking, Jeffrey, when you don't want to play Legos with me, right? What am I thinking when I'm not interested in what you're talking about? And these are really good because it literally changed kids to look at stuff from your perspective. And the amazing thing about this, folks, it is so rewarding when my patients actually start being able to answer these questions. I have a really smart kid, high functioning, and he goes off about this game he loves to play. And he just goes on and on. And I told him, what am I thinking when I'm not interested in you talking about this game? And he says, because you don't play this game, Dr. D, so you're not really interested in learning about it. So I should not mention it in so much detail. And I said, exactly. And I says, what happens if you're talking to your friend who also plays the game? Should you talk about it more or less? And he was able to say more. And I said, well, why? Because he also plays the game. I said, exactly, right? Those are big victories for kids, right? That's going to help them when they get pulled over by a cop and the cop says, sir, ma'am, you were speeding. And they're like, well, not according to my speedometer, I was not. Well, I'm not interested in your speedometer. I'm interested in my radar detector, because those things can go bad really quickly, right? So perspective taking is a huge part of later adulthood social exchanges. And it's very important for relationships, right? I like this one. What am I thinking when you argue with me? That I'm rude? I was like, yes, because you're a child and I'm an adult, right? You can help the kids understand that, because remember, kids may see you as their equal or see you as a threat when you try to parent or discipline them. And they need to understand that there is a hierarchy of power, and that means they cannot be on equal footing with you. Because then if you punish them for being on equal footing with you rather than teach them that they're not, the problem is they get really good over time of fighting you more or better. And that's where aggression comes in. Let's talk a little bit about some other critical social skills. This is beyond an hour-and-a-half presentation, but these are some of the other things that I include, right? Mind reading, which is the ability to understand other people's feelings, other people's thoughts. But not only that, but to be aware that people do have different thoughts from you, right? And they have different beliefs, right? So kids might be offended that you don't play Pokemon and not understand, well, I don't play Pokemon. I drive a competition BMW M3, and that's my equivalent of a Pokemon. And I tell that to kids all the time, right? So they understand that we have different interests. Imitation behaviors, that is a skill I teach quite a bit, is actually one of the measures we look for diagnosis of autism using one of our measures. Conversational and informational gesturing, like looking in this cartoon picture, right? Nice shirt. He outstretches his arm with his fingers spread like that. He says, nice shirt, right? That's a gesture of a compliment. We focus a lot on empathy training, asking questions, giving compliments, doing kind deeds, making requests. We are hoping that at a later date, like what Neil had mentioned, we are hoping that we could try to do an all-day workshop where we can give you a lot more skills and a lot more examples on the way you as parents can teach these skills so that they supplement what your providers and educators are doing in the school, right? Because for some of you, we know it's what providers and educators do is simply not enough, and we need your help to help your kids, right? Remember, you are the actual superheroes. I want to talk a little bit about some of the programs we do at our center. These are 3 examples of programs we run. We run a summer camp called Cool Kids Program, and where we teach kids to cooperate, get along with others, accept failure, right? Or setbacks is what we call it. We have a program called the ADHD Brain Smart Program where we teach executive functioning, because we know oftentimes kids on the spectrum have a lot of prefrontal, precortex challenges with executive function. Creative Explorers, this is our social skills that is primarily targeted kids with social skill challenges, and namely autism. Right now, I keep looking at, I'm in my conference room in my center, and I keep looking at my door because I have 4 kids on the spectrum that are doing a social skills, and I'm just waiting for one to bolt in and come and see a closed door to come find me, because I'm not running the group. So they'll be probably wondering where Dr. D is, because I emphasize a lot of social awareness. So I make sure these kids look at me. This is the room they're in now. Of course, this is pre-COVID, right? So we won't have kids sitting so close. But this is how I do my social skills or any of my programs, because all my programs have a strong emphasis on social skills, whether it's on anxiety, ADHD, social emotional development, or just social skills like the Creative Explorers, right? This is very important. And because I'm from the Caribbean, I love a party. So we always have a graduation. This is a graduation party for kids from my summer camp. And a party is not a party unless you have some kind of cake. So one of my resident counselors, she is an artist when it comes to doing cake. So the kids always get a special kind of treat so that the experience is positive for them. So that concludes the information part of the presentation. I know we wanted to leave some time for an opportunity for parents to ask questions and give feedback or comments, criticisms, whatever the case may be. So I guess, Neil, if you want to take it from here and guide us, or Trish.
Sure. Can my video come? I know my video is not on, but is my audio coming through? You can hear me?
Yes, sir.
Great. I think that was terrific. Thank you so much. One of the questions that somebody asked is, how do you help other kids sort of in the neighborhood to deal with their child when a difference has already become apparent to them? I mean, and they're treated differently, but their son is sort of unaware of what's going on. What can you do to help, I guess, the neighborhood kids or kids who they may be interacting with on a daily basis?
Sure, that's a great question, and I get that quite a bit. And actually, the answer is it's quite straightforward. Because your paternal instinct kicks in and you see the way your child is treated or marginalized, and that mommy or daddy instinct just is visceral in you, and you want to protect your kid. I say don't. I say put your kid in harm's way, which is that social exchange, but coach them and supervise them. So when your kid makes a mistake in front of that kid, correct your kid in a way by asking those clarification questions. So you're not correcting the kid or disciplining them, you're teaching them in the moment, because that's one of the drawbacks of providers and educators. We teach in this artificial world. And that is why I developed all these programs, because I wanted kids to have in the moment, right, in vivo exposure to challenges and correct it in the spot. So I would suggest, rather than mingling with other parents or staying inside and preparing dinner while your kid is outside, fraternizing with the neighbors and the neighborhood kids, I would say you go out there and you supervise them so you can catch their limitations or gaps or challenges and correct it in the spot. You can say something like, honey, come over here. I want to tell you something. You see how you kept talking excessively to Jeffrey? Well, he's bored. Boredom means he's not interested. So I want you to shorten your conversation. Do it with me. Let's practice what you did with Jeffrey. Because right there, you have a great opportunity to teach your kid in the moment while it's still salient, like that memory or challenge is still fresh in the kid's mind and yours, and you can correct it.
Great. Another question in the box, when seeking social learning resources, what types of credentials should be noted?
Well, credentials are big words and they may mislead you. And that's why my first slide, I said I want parents to be good consumers of mental health and advocates. These are some of the questions you want to ask. Does your curriculum include looking back at some of the developmental milestones that my particular child did not develop? A good clinician will be asking you that. Did your child smile at you? Or does your child did your child engage in parallel play only, or can your child do pretend play? If your clinician does not ask those questions, you can say, well, can you look at that? Because even if they may not ask the question, they may be aware of how to correct it by you advocating for your child. So, and further, by being a good advocate for your child, what I encourage, because all too often I hear parents, they're not really aware of what the providers or educators are doing. Even if you have an IEP, you get this 25-page document and it's well written, because I know Talbot and Queens Anne County do great work with their IEP system. But you have to understand what those goals and objectives means in terms of practical everyday experiences. So I encourage you to ask special educators and speech pathologists and counselors, what exactly are you working? One of the things I do, like I mentioned, I keep parents in a room. It's a lot more work because parents have questions and kids resist, but that's okay. I believe in what parents are going to do at home in that 24/7 day a week cycle, and I need their help. And that's why my kids accelerate faster than, say, other providers, because parents are going home with lots of homework, lots of motivation, and lots of skills.
Okay, great. I would love to have an only 25-page IEP. I remember when my son's IEP was only 25 pages. This is one that hits home. This language arts and reading teachers, quote unquote, taught my child how to make inferences from reading passages. My son, you could say my son as well, has a pragmatic language disorder, struggled being able to predict what could happen, draw conclusions. How do we teach that skill, even though it feels like it comes so naturally to us? How do we teach that effectively?
Well, that's a great question, because this is one of the frustration of parents, because pragmatic skills is one of the last frontiers before your kid has better social skills. And for kids on the spectrum, especially those that are high functioning, is a part that's missing. High functioning kids with autism may not have restricted interests, very socially motivated, very socially aware. They just don't have that social communication component, which is a category in which pragmatics is placed. So you have to directly teach it. And in your slide, I pointed out 4 parts, and there are more, of course, but I just wanted to give parents a flavor of what we're doing. You have to teach them to make inferences in the moment, and it's like, read between the lines. When I tell you no, when you ask me for an ice cream, what am I thinking? And you want to encourage that kid to say, because it's almost time for dinner and you don't want me to not eat my dinner. You literally have to manually walk them through this. Are they still going to resist you and demand you give them an ice cream? Absolutely. But don't let the discipline component of their defiance dissuade you from still teaching them the skill, right? Because they may be able to apply it in writing conventions, right, or reading an essay, but they will find it really hard with social interactions. Like you mentioned, Neil. Neil mentioned about drawing a conclusion. They have difficulty in drawing a conclusion from a social exchange. They walk away thinking that that kid's their friend. Hey, mommy, I just made a new friend. That kid walked away saying, I'm not playing with that kid again, right? So we have to, it's a definitely component of social skills, but it's one of the last things you want to teach. So if your kid is high functioning or has social language pragmatic disorder or has some anxious mood disorder, ADHD, or even a specific language disorder, we see kids have difficulties with these diagnoses with pragmatics as well. You teach that last, but you got to give them the foundations in what I'm talking about. And also, as a good advocate, there are tests that you can use just to test for pragmatics, right? So that's something you can talk with a provider with your special educator and see if that's something the school will or can do, right? Special education is just one part of the puzzle. It's not comprehensive care. And I always advise parents, don't rely on just special ed. They're part of the puzzle, but it's not all inclusive. They have, it has to have an educational impact academically for the most part.
Okay, great. Another question, a mom to an adult child very loud in volume, very high pitched. What kind of recommendations would you make for this issue?
Okay, great question. I actually deal with that with a 25-year-old. One of the things I do, I call them therapeutic themes. I give keywords to prompt the kid, like pause, slow down, calmly, and I use those during the kid's conversation so I don't interrupt the flow, right? So when the kid is talking loudly, I would say slow, I would use a gesture like my finger, slow down, and the kid sees my gesture and integrates that gesture into his or her conversational flow in actually talking a little less fast, a little less rapidly, a little less loudly. So the bottom line is find keywords that you can use to prompt your kid during an interaction where they can self-correct in the moment. Because again, like I mentioned, the frustration with social skills, it's all artificial. You know, I know like in my programs, I sabotage my environment. I would put 4 kids to play build a Lego, and I would deliberately take out the last 2 pieces. So what I'm encouraging them to do at that point is how do they resolve that dilemma? Because they start fighting with each other and I say, pause, let's work it out, right? What else do you need? So I keep them in the fray and I give them the tools to resolve it. So to that parent, I would say, let your kid keep talking, but give them certain prompts that are minimal so you don't interrupt them or shame them or discipline them that they can readily use to adjust their conversational skills.
Okay. One mom, I'm guessing a mom, sorry, don't want to assume. Best things to do for a 3-year-old in addition to making sure the basics are addressed is how it's written.
Sorry, Neil, can you repeat that?
What are the best things to do for a 3-year-old in addition to making sure the basics are addressed?
Well, it really depends on where that kid's needs are. Is there a language delay or absence of language? Are we seeing some sensory issues? Are we seeing that they're not making adequate milestones? And I encourage parents to go online and put up developmental milestones for 3-year-olds. Pediatricians do a good job, but in 15 minutes, they don't have enough, in fairness to them. So you can look at where your kid is or should be at 3, and wherever you see a deficit or delay, you can train that and you can seek advice from an educator or provider and says, hey, you know, my son or daughter does not play appropriately with his toys or her toys. What can I do? And they can give you some concrete examples of how to do that. I had a father, for instance, he didn't know how to play with his kid because his kid had moderate autism. So he did a lot of redirecting with his kid. And the father, myself, and the boy would go outside, and I would be literally teaching the father how to help a kid on the spectrum who was 4 years old that didn't have pretend play. And the father loved it. He would go home and practice it. Kid's better. The kid comes to my office all excited. Are we going to play the Pokemon game again? I was like, absolutely, but not with me, with your dad, because I want to grade your dad with his social exchanges.
Yep. Apologies to Lily. I did not mean to skip your question. Where should I start with a 14-year-old with little to no social skills? What appropriate books and videos can I get for this age to work on social skills?
Well, that's a great question, because oftentimes by the time I see kids that are in adolescence and they have not closed the gap or closed the gap sufficiently, we have to go back to the basics. You may have to, you definitely need some support with that child, because at 14, if they have such struggles, this is beyond the range or ability of a parent. But being a good consumer of mental health means you can ask the right questions, such as, can you identify the specific gaps that my kid manifests, and how may I help at home with the homework assignments you can give me? You don't want your kid going into a therapeutic room or office, doing the work with a skilled clinician for an hour and coming out smiling and think it's enough. You have to go home and do the 24 hours, 7 days a week, right? And that kind of questions are best geared towards your special educators that service your kid, your general educators, your pediatrician, and whatever clinician you have for that kid. Be a good consumer, an advocate, and probe more so that they can give you some of their tools, would be my suggestion.
Great. Let's go back to pragmatic speech for a minute. One question is, should pragmatic speech be addressed first and then do anxiety intervention, or vice versa?
Remember, it really depends on the kids. There's no size that fits all. People call me a kid whisperer in my practice, and quite frankly, that's not true. I'm a kid listener. Kids tell me how to help them. So I might have a kid and his primary symptoms are anxiety. So I'm going to tackle that before I even get to the pragmatics, because I know if I challenge a kid with pragmatics, where I try to teach it, that kid's going to bolt from the room or have such an uncomfortable experience that they wouldn't enjoy it. So there's no positive memory. On the flip side, I might have a kid who presents with anxiety and pragmatics, but I can dive right into the pragmatics and either put a hold on treating anxiety or doing it conjointly, right? Or sometimes you need two different therapists. We call that network therapy. And with kids on the spectrum, oftentimes they need that comprehensive care. So once again, it really depends where that kid is. But as a good advocate or consumer of mental health, you can ask or challenge your clinician to think more about your kid and what their specific needs are, because it varies.
Thank you. One of the questions in the chat box, and it's something that I've read about a lot because I read a lot coming out of self-advocate networks and things like that, is it seems like the onus, as Alan puts it in the chat box, the onus is on autistic individuals to modify their behavior rather than getting society to sort of accept and modify their own to work with the autism population. How do you feel about that?
Well, in an ideal world, we can rely on everybody as a community to help those that are different or those in need. And the great thing about this country and why I enjoy living here and feel privileged is that America's done a really good job of advocating for differences. Is it enough? Well, no. And this is where the actual superhero comes in, and why I want parents to access as many resources and many providers as they can in helping them. Because we have a high incidence rate of autism in Maryland. And although we have many resources, they're far and few in terms of being available and and being you being able to get them frequently. So it really comes down to you pushing as much resources that your finances, your energy and time for both you and your child can afford, and doing as much as you can to move your kid more to the mainstream rather than waiting for mainstream to come get your kid. That's my belief, and I say that as a provider because my job is to serve and deliver to my families. And I keep quite busy doing it, and I like to work towards closing the gap.
Very good. This one just came across. I'm just reading it now. Something I've always taught my children is that everyone is different and not any two people learn the same way. So they're willing to see that and accept people more easily. So that's not the question, but that's a really lovely sentiment.
Yes.
I really hope everybody sort of does that, is that just giving that understanding that no, people are unique and different, and not everybody is the exact same. And how boring would the world be if everybody was the exact same?
Well, Neil, if I may, that kind of taps into that parent teaching their kid about tolerance, not for one thing, not for like sexual orientation or ethnicity, but when you teach your kid the social exchange of tolerance, meaning you could interact with someone and tolerate them, the idea of tolerance can be applied universally to anything.
Right.
And that's why I think rather than we use specific examples, but we must keep the big idea in place. Like that's why I use big ideas rather than specific goals. Empathy training, mind reading, because if I teach a kid to mind read or empathize, guess what? They can apply that universally. Just like that mom is doing a great, or father is doing a great job of teaching tolerance. And with that, you have that universal application.
Yeah, thank you so much. I agree with you completely. It would be nice if the whole world was adopting that theory. So we're all working towards that, I think. And a lot of the presentations we do is just teaching that understanding, and everybody's completely different. One last question. We have time, if you may. Can you give an example of pretend play?
Absolutely. So I had a 9-year-old who loves Transformers, and of course, pretend play is more common in 2, 3, and 4-year-olds, right? That's where we see it emerging. But this kid who was on the spectrum and had delays, he loved Transformers, and he just went into this pedantic lecture about everything about the movie. And I told him, I said, let's pause, because I was teaching him to pause, to interrupt that pedantic way of speaking to people. I says, let's go outside, let's find some sticks, and let's engage in robotic wars to prevent the Transformers from invading the planet. That's pretend play. Another example is the one I use with my pen. This makes this Mont Blanc a very expensive great pen, but it can also serve as a really cool F-15 fighter jet, right? Pretend play is using toys and pretending, giving them different functions, right? A little girl that picks up a phone and has a conversation, that's such functional play. She's using the phone appropriately, but pretend play is when she talks with you. So you pick up a glass and you talk with her, and you all are having a pretend conversation using a glass and a phone.
Great. Well, terrific. Thank you all so much. Thank you, Dr. Isava, for your time and for this information. Thank you to everybody who attended. Keep your eyes open. We're going to be emailing out a survey and a recording from today for everybody. That'll be coming out probably Monday. So if you have a chance, please answer it and give us your honest answers and feedback, because that helps us guide where we design our workshops going forward. So thank you again to Dr. Isava. Thank you to Jennifer and to Stacy for all their help from Talbot County and from Queen Anne's County. Thank you to Trish and Shelley who are in the background. Everybody enjoy your Saturday and have a great day. Thanks again, Dr. Isava.
Thank you. Bye.